The Tokyo Olympics opened Friday after a year-long postponement due to the coronavirus pandemic. The global health crisis is still ongoing, and the surge of new infections caused by the Delta variant, concerns are remaining over the safety of holding the Games, even though they will be free of spectators. Several athletes have already tested positive for the virus, and global health experts warn that the Games could turn into a super spreader event. Will the Tokyo Olympics be held safely and successfully? To discuss the delayed 2020 Games and its local and global impact on public health, we turn to Ben DOOLEY, Japan correspondent at the New York Times. We also connect with Dr. Michael TOOLE at the Burnet Institute in Melbourne. Very warm welcome to you both. Thank you for joining us today. And well, to go straight into questions, starting with you, Ben, well, today the Tokyo Olympics are opening in Tokyo, and what's normally a very grand opening ceremony is going to be quite low-key, with only 900 people set to attend. But after a year of being postponed, the big day has finally come, and despite concerns and protests by some locals over the surge of cases, how is the mood in Tokyo right now? Is it celebratory at all?
Yeah, thank you for having me today. I'd say the mood it's complicated. It's a mix of anticipation and trepidation. People are obviously excited to have the world's largest sports pageant here in Japan. I'm just around the corner from the stadium, and people are lining up all day to take photos there in front of the Olympic rings. But at the same time, there's a very serious element of concern. About 80% of people polled in Japan wanted to have the Olympics either delayed or canceled because of concerns about the virus. And they're just worried, as you mentioned, that it could lead to an acceleration of the virus here in Japan. They've managed to keep it under control, fairly well under control so far. So it's as people flood into the country, they're worried that they might lose ground, and it's a big concern for people here.
And well, Ben, officials, they've still insisted that they can hold the Tokyo Olympics safely even amid the pandemic. But there have already been dozens of cases where people very closely related to the Olympics, including several athletes, have been tested positive. Do you think that it's likely that the Games are going to be held COVID-free? And well, what kind of measures are being taken at the moment by the organisers to ensure that the Games are as safe as possible?
Yeah, I think that it's impossible for the Games to be COVID-free. I think there was an expectation from the beginning that some people would get sick, that was inevitable. But the goal was to keep those numbers as low as possible. As of today, a few dozen people have gotten sick, but when you look at the total number of people who are participating, the positivity rate is actually quite low. It's, I think, 0.01% is the latest statistic. So from that perspective, things are proceeding fairly well so far. Of course, time will tell. As you said, there have been some cases in the Olympic Village of people who have tested positive. And the concern, obviously, is that with the Delta variant, which is meant to be much more contagious than other variants of the coronavirus, that cases could spread quite rapidly.
Well, the Delta variant definitely is a big concern. And Michael, with this new variant taking the world by storm, would you say that the measures being taken by the Japanese authorities are going to be enough to stop transmissions, or at least minimize the spread?
Good morning. I have read the IOC playbook for athletes and officials, and I think they are taking quite good precautions. However, I am concerned that it's not mandatory for athletes to have been vaccinated. And while the IOC expects 80% to be vaccinated, that leaves a lot more than 1,000 just athletes who are not vaccinated. And they're arriving from countries where the vaccination rate is very low. For example, the long distance runners from Tanzania are coming from a country where not a single dose of vaccine has been administered. I'm also worried about the large contingent of journalists and other support staff, again from more than 150 countries, and their playbook is a lot more relaxed than that for the athletes. They can more or less stay where they like. They can catch public transport. So I'm perhaps more concerned about that group. And finally, I'm concerned about the up to 80,000 Japanese volunteers who will be in close contact with both athletes, media, and other support staff. And I don't know how many of them have been vaccinated. They also will be taking public transport, and most of them are young and will be going home to their parents and grandparents. So I think there are some potential opportunities for widespread transmission of the virus.
Michael, well, even if a lot of people were vaccinated, to what extent is mass vaccination going to work against the new variant? I mean, we've seen countries like Israel where most of the population have been vaccinated, but they are getting infected.
Yes, we don't know what that figure is because no country has reached a level of vaccinating their population to allow them to open up, ease restrictions, and not have outbreaks. So you mentioned Israel. They're reporting about 1,500 new cases a day, all Delta, mainly in young people, unvaccinated people. And of course, the UK heading towards 50,000 a day, the Netherlands, Spain, Portugal, even Malta, which has vaccinated 71% of the population, is having a surge in cases. Now Japan's down a long way down that list. Perhaps 25% of the population may have been fully vaccinated. Fortunately, in Japan, it's more than 80% of the older Japanese. So that's a good sign. But the level of vaccination in Japan will not prevent the spread of the virus.
And Ben, well, despite a lot of warnings and even protests against the Games in Japan, it seems like the organisers felt that they couldn't afford not to hold it, as money obviously is involved. But major companies like Toyota, they've withdrawn their commercials, and big names on the guest list, including heads of state, they're not going to be attending. So there's clearly sort of a retraction of support for the Olympics. What were the costs of really not opening the Olympics? And do you think that decision to hold the Games is going to pay off in the end?
Well, the most immediate cost, of course, is the lack of spectators. There's a stadium around the corner from me that is capable of holding 68,000 people. And as you said, about 950, I think, will be there for the opening ceremonies tonight. So that's a big blow for the Japanese Olympic Committee, which depends partly on ticket sales for its financial support. And of course, all the other events, people had their tickets canceled. But on a broader scale, of course, Japan, the Olympics, I think, are very rarely a profitable event for most countries. They end up down, and these Olympics have been particularly expensive. But there was an expectation that the economy would make up for, the costs of the Olympics through increased tourism, so on and so forth. Obviously, once the pandemic struck, that looked like it would become an impossibility. And in fact, now, tourism to Japan is basically non-existent, as the country is largely closed to outside visitors. So you have a lot of large investments that were made in the lead up to the Olympics in the hopes that that boost to tourism would pay off. Hotel operators, restaurants, et cetera, that are now really concerned because, they spend a lot of money, sometimes went into debt to upgrade their facilities or build new ones. And obviously, they're not going to see the benefits of this Olympics as they had hoped. So that's a huge economic blow. For the companies that you mentioned, we've seen Toyota, for example, decided it won't be airing Olympics commercials. And other companies have said they won't be sending their top executives to participate in the opening ceremony. I think that that's more of a concern about sort of the optics of having their top representatives at the ceremony, when the average person can't attend. I think that would look bad for them, obviously. And yeah, they've invested a lot in making commercials, et cetera, for the Olympics. Obviously, they did that well in advance of the games that were meant to happen around this time last summer. So for a lot of those companies, there is certainly a direct financial blow from that as well.
Well, Michael, the decision to restrict or lift restrictions, really, it's always a trade-off between public health and economics, it seems. And what do you think about this decision? What do you think, what kind of impact do you think transmissions that might occur at the Olympics will have on global health?
Well, there is a rule for the athletes that after their event, they should go home as soon as possible. So I'm a bit nervous that some athletes will have been recently infected, not yet having symptoms, not yet testing positive, and fly to their home countries and then test positive. And of course, some of those athletes will be from poor countries where the health system is not very strong. So I am afraid that could happen. You know, I'm thinking again of the country I mentioned before, Tanzania, Kenya, Ethiopia, and quite a lot of other countries. So even though athletes will be tested every day, it does take 4 to 7 days from the exposure to an infected person to then test positive. And during that time, of course, that person can in turn spread it to other people. So just coming back to the games, I don't think there will be a big super spreading event at the games. Oh, sorry, at the Village. But I fear that there will be disruption to a lot of the events, and I'm thinking particularly of the team sports. We've already seen South African football players tested positive. I think a Czech beach volleyball player. If particularly the indoor team sports like basketball. Now, if one team member tests positive, the rest of the team will have to isolate. So if that's just before, say, a semi-final, that means the semi-final is off. So I would fear for those kinds of disruptions.
Right, well, we really hope that none of the athletes nor the staff involved in the Olympics get infected, and really fingers crossed for that, especially for the team sports. And well, Ben, dozens of people involved in the games, though, they have tested positive for COVID-19. And the CEO of the Olympic Games, he said that he's not ruling out the possibility of cancelling it if cases suddenly spike. How likely do you think this scenario is?
Well, I don't want to say it's impossible because you never know, but I think that there's a very, 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 very low likelihood that the games will be canceled. I think that for that to happen, I mean, there would have to be a very serious outbreak among the athlete population. Everyone is already here. The whole event is in train. It's certainly possible, as Michael said, that certain events could be disrupted, but for the whole games to be canceled, I think that's extremely unlikely.
Well, Michael, you've previously described the decision to hold the Olympics as one that defies epidemiological logic. And well, what kind of scenarios do you think health authorities should really prepare for?
I think they have to be very prepared to do rapid contact tracing. When I say that, I'm thinking of an athlete or a member of the media or an official infecting a Japanese citizen, and then that Japanese citizen going home. So they'll have to be really ready to do very quick contact tracing and further testing. Within the Village, as I said, the playbook does have very good precautions about testing every day, about social distancing. Though I must say, when it comes to change rooms and gyms, I'm not sure how those social distancing precautions can actually be implemented. So I'm more worried about the virus getting out of the overseas contingents into the Japanese public at a time when, as you know, Japan's reporting about 4,000 cases a day, and just in Tokyo alone, it's reaching more than 1,200 a day. So it's a very precarious position that Japan finds itself with this Delta variant, which is so infectious.
Well, I'm afraid this is all we have time for today, but we here in South Korea really do hope that the Olympics go ahead very well and very safely, and that, well, the number of cases or the situation will be very contained if anything breaks out. But that was Ben DOOLEY, Japan correspondent at the New York Times, and Dr. Michael TOOLE at the Burnet Institute in Melbourne. Thank you both so much for your insights today.
Okay,
Thank you.
See you.
And to our viewers, as always, thank you very much for watching.